My name is Ola Saugstad. I'm a pediatrician and based and live in Oslo, Norway. In fact, I'm a neonatologist. That means that I work with newborn babies. So I've been senior consultant of neonatology at the National Hospital in Norway for more than 30 years. But my main position, my main job was to be professor and director of the Department of Pediatric Research at the University of Oslo. And this is the largest research institute for children's somatic health in Norway. I've been retired from these positions a few years, but I still have a position as adjunct professor at Northwestern University in Chicago, Illinois, in the United States. Yeah, my main focus during almost 50 years now, I started my research right after medical school in Oslo. It has to be on newborn babies with lack of oxygen, birth asphyxia. So I've been working with oxygen and how to oxygenate newborn babies optimally for many years, and I'm still involved in several clinical studies around the world, international studies, but how we should best oxygenate, especially babies born preterm. And also, a main part of my research has been to do animal studies. So we still are running animal studies in Oslo, trying to find the best way to oxygenate newborn babies. The clinical trials I'm involved in now is how we should oxygenate the most tiny babies, those who are born, let's say, more than 8 or even more than 12 weeks preterm, immature babies, because these babies are very fragile. Their lungs are not developed. Very often they need some extra oxygen right after birth. But on the other hand, they're also vulnerable for what we call oxidative stress. That means that oxygen may injure their organs, the lungs and even the brain and other organs. So what we are striving to find is how much oxygen should we give? And that's not an easy answer because it varies, of course, from baby to baby, but it also varies the first few minutes after birth. Maybe we should start out with a high oxygen concentration and titrate down very quickly, or maybe we should start low and titrate up very quickly. So within the first 10 minutes, we have to find the optimal way to oxygenate. And so this takes a lot of time, and an international collaboration is in fact needed to do that. Yeah, so that's another part of my research. I've always tried to collaborate internationally because Norway is a small country, and it's important to kind of find the best environments and the best researchers in my field in other countries. So I always had international collaboration. I also spent some time in the US at several occasions. So I'm part of an international network, but then I have another research interest, and that is what we call the pulmonary surfactant therapy. The preterm babies, they lack a substance called surfactant, which is coating the inside of our lungs, and this surfactant, it's kind of a detergent, a kind of a soap, which prevents the lungs from collapsing every time we are breathing out. But preterm babies, they lack this substance. It's called surfactant, and it's a mixture of lipids, phospholipids, and proteins. Now, the last 30, 40 years, surfactant has been installed into the lungs of premature babies, and I've been involved in some of this research. And then we have collaborated very closely with pharmaceutical companies. And if I may mention one, it's an Italian company named Chiesi, which is based in Parma, which is now producing the most sold surfactant worldwide, which is based on pig lung surfactant. While when I talk about the surfactant part of my research, it's been fundamental. I mean, without that, we wouldn't have achieved what we have done. It's been a very, very fruitful collaboration and with mutual respect, I would say. And so this has been an important part of my research. And I think both sides will learn a lot from each other. And once more, we learn to respect each other. So that's been important, I would say, important part of my research career. Yeah, I've been active in many medical societies during the years. If I mention two, first of all, is the European Society for Pediatric Research, which is the kind of the research organization for European pediatricians, which has expanded substantially the last 20 years. I've been active there for, I would say, most of my career. I was a member of the board for several years, and then I was chairman of the neonatal branch of this for several years. So that's been very helpful, and also been very helpful to get contacts in Europe. And another society I've been involved in is the European Association of Perinatal Medicine, which is the largest society in the world regarding perinatal medicine. That is the part of the medicine which involves the pregnant woman, the fetus, and the newborn. So I was in the board of this society for 10 years. 2 of these years I was also president of the European Association. And the last years I have been involved in the Union of European Neonatal and Perinatal Societies, UNPS, where I've been head of the research of this society. So I've been very active in several societies during my career. And I found it very, very helpful. So first of all, I get contacts and friends, colleagues with whom I can collaborate. But these societies, they create guidelines and also organize meetings, congresses. I've been involved in many of the big congresses. For instance, the very recent joint European Neonatal Society meeting in Rome in September. This year, the biggest in Europe. I was part of the scientific committee of this meeting. So that's very useful. I should also mention the European guidelines for treating preterm babies or newborn babies with respiratory distress syndrome is maybe the biggest problem or challenge for preterm babies, because this is caused by lack of surfactant, which I mentioned. So since 2007, a group of us have published European guidelines for how we should handle these babies, all aspects of handling of these babies. And every third year we have renewed these guidelines, and I think they are accepted all over the world. Wherever I go, they are applying these guidelines. And so last year we published our 6th version of these guidelines, and these guidelines are published in Neonatology, the journal, which is published by Karger, and very, very much cited. Well, I feel it's very professional. And of course, I've been taken very well care of, I think, because to start as an editor-in-chief, I mean, I've been in editorial boards of several journals during the years, but it's different when you have the responsibility, the final responsibility. So I feel I got very good backing from the staff of Karger. So I'm very, very satisfied, and it's a new experience for me to see how a big journal is organized, because it's much more complex when you see it from the inside than I had understood when I just submitted articles or were member of the editorial board.